Good evening to all. I hope I am audible to you. All. Good evening to all. I hope I am audible to you. Good evening to all. I hope I am good evening to all. I hope I am audible to you. Okay, so today we are going to see the next chapter. We have already seen biochemistry of carbohydrate and its metabolism, right? After that, we were started with a drug used in the diabetes, right? Now, we have also seen the biochemistry of lipids and its metabolism, and that's why we are today we are going to see hypolipidemics. So we have already seen the biochemistry of carbohydrate, its metabolism. After that, we have taken the diabetes. Right? After that, we have seen its chemistry. Right? In the similar fashion, we have also completed biochemistry of lipids and its metabolism. So now, once you understand the biochemistry of lipids and metabolism of lipid, which is the basis for hypolipidemic drugs थेराप्यूटिक्स, तो ये लिपिड जो है वो बेसिक चैप्टर होता है और उसके ऊपर फार्माकोलॉजी में हाइपोलिपिडेमिक ड्रग्स ये अप्लाई चैप्टर होता है. तो दैट्स व्हाई वी आर टेकिंग इन दिस फैशन सो अंडरस्टैंड बेटर वे, राइट? So hypolipidemic drugs. We are going to see the pharmacology aspect of hypolipidemics as well as medicam aspect of same. So first of all, what do you mean by hypolipidemic drugs? As the name indicate, what the name indicate? Hypolipidemic. Hypo means less. Epidemic drugs means the drugs which will decreases the lipid level of your body. Drugs which will decrease the lipid profile of your body. आपके बॉडी का लिपिड लेवल जो ड्रग कम करते हैं या फिर लिपिड प्रोफाइल जो कम करते हैं, क्या बोलेंगे अपन? हाइपोलिपिडेमिक ड्रग्स. तो ड्रग which decreases the lipid level in the body and they are known as a hypolipidemic drug. They are obviously used in the hyperlipidemia. अगर आपके ब्लड में लिपिड लेवल बढ़ गए तो उसमें यूज करते हैं. इफ यू आर ओबेज, if you are suffering from coronary artery disease, atherosclerosis, so in that case such kind of drugs are used to decrease the lipid level of your body or cholesterol of your body. So drug which decrease the lipid level in the body and lipids, whatever lipids you are taking in the diet, fats and oils, cholesterol, butter, etc. We have seen in the biochemistry. Lipids are distributed in the body in the form of lipoprotein. जो होते हैं खाने में, जो आप फैट्स, ऑयल्स, जो भी आप बटर वगैरह खाते हो, वो दैट लिपिड इन द बॉडी इन द फॉर्म ऑफ लिपोप्रोटीन. प्रोटीन के फॉर्म में वो बॉडी में चला जाता है. इसका क्या होता है? लिपोप्रोटीन्स आर नथिंग बट द मैक्रोमोलिकुलर कॉम्प्लेक्सेस ऑफ लिपिड विद प्रोटीन. और लिपिड और प्रोटीन का जो कॉम्प्लेक्स है उसको अपन लिपोप्रोटीन्स बोलते हैं. जो लिपिड्स है वो बॉडी में डिस्ट्रीब्यूट किया जाता है इन द फॉर्म ऑफ लिपोप्रोटीन्स, राइट? तो कौन से कैरियर फॉर लिपिड इज लिपोप्रोटीन या फिर कोई कैरियर है लिपोप्रोटीन्स के टाइप्स होते हैं. कैरियर होता है लो डेंसिटी लिपिड, एचडीएल हाई डेंसिटी लिपिड, VLDL very low density lipid, IDL intermediate density lipid, and chylomicron. Going to see the in the detail. Lipoproteins, they are nothing but the macromolecular complex with the protein, and they consist of a non-polar core part. Central part of this lipoprotein is a non-polar core, which is made from a triglycerides and cholesterol esters, and the polar part is nothing but the phospholipids. जो lipoproteins होते हैं, we already seen the structure in the biochemistry. So the core is a non-polar made from a cholesterol, triglycerides, and the peripheral part is a polar because of the phosphorus. So non-esterified cholesterol. Lipoproteins are embedded in that. So lipoproteins, they have a very important role in the distributing the and also recycling the cholesterol. तो कोलेस्ट्रॉल है उसका डिस्ट्रीब्यूशन एंड रिसाइकलिंग रोल किसका है, वेरी वेरी इंपॉर्टेंट रोल है उसमें तो lipoproteins has a very important role in the distributing and recycling of cholesterol. What is the normal plasma total lipids? आपके ब्लड में कितना लिपिड्स होता है? नॉर्मली फास्टिंग प्लाज्मा विल हैव 700 mg ऑफ टोटल के ब्लड में 700 mg लिपिड्स आएगा. उसमें क्या करेंगे? टोटल लिपिड मींस इंक्लूडिंग योर ट्राइग्लिसराइड्स, कोलेस्ट्रॉल एंड फॉस्फेट. What are these lipoproteins? Macromolecular complexes of lipid with the protein. There are different lipoproteins. Say, first one is a chylomicron. Chylomicrons mostly consist of a triglyceride. Chylomicrons में ज़्यादातर क्या होता है? Triglyceride. Chylomicron remnant. Chylomicron remnant means after the metabolism, after the breakdown of lipoprotein, so chylomicrons will be separated and whatever will remain, mostly cholesterol, chylomicron remnant. Okay, then third lipoprotein is a third type is a very low density, which has a mostly again triglycerides होती है. Intermediate density lipoprotein. Intermediate density lipoproteins is ideal. LDL is there. LDL मतलब क्या? Low density. In the LDL mostly cholesterol, ये सब क्या है? They are the transport proteins. These lipoproteins are the transport facility. You can say transport, the way of transport of lipids in the body. So LDL is mostly carries the cholesterol. That's why it is also known as a rough language bad cholesterol. Also known as a bad cholesterol, the rough language. क्यों LDL को bad cholesterol बोलते हैं? Because it carries mostly. LDL is not a cholesterol. LDL cholesterol नहीं है. It is a complex of lipid with a protein. It is a lipoprotein, but this lipoprotein mostly carries the cholesterol. That's why it is known as a bad cholesterol. आपके टेलीविजन में वेरियस एडवर्टाइजमेंट्स आते हैं, जैसे सफला ऑयल है ना, अक्षय कुमार सफला ऑयल का एडवर्टाइजमेंट करते हैं, उसमें बोलते हैं इसमें नहीं है बैड कोलेस्ट्रॉल, इसमें नहीं है. वैसे animal fat. Then lastly, then sixth type is a high density LDL. LDL हो गया HDL. Chylomicron remnant, very low density lipoprotein, intermediate density lipoproteins, low density lipoproteins, and now high density lipoproteins. HDL is known as a good cholesterol because it HDL is known as a good cholesterol. It carries cholesterol from tissues to the liver for the breakdown of cholesterol. And 7 is a lipoprotein. These are the different types of lipoproteins, that is a chylomicron remnants, then very low density lipoprotein VLDL, intermediate density lipoprotein IDL, low density lipoprotein LDL and high density lipoprotein. So LDL, low density lipoprotein, is commonly called as a bad cholesterol because it carries cholesterol from liver to the tissues. That's why bad cholesterol. And bad is bad in terms, why it is bad? Because it carries the cholesterol to the tissues. For example, it carries the cholesterol from liver to the arteries and small arterioles, which can cause stroke and uh, that death. That's why it is known as a bad cholesterol. And LDL, is bad. HDL is good. Why? HDL carries, again, it also carries cholesterol, but it carries cholesterol from the tissues to the liver, right? That's why HDL is a good cholesterol. Now, you eat too much lipids, the condition will like this. Like this person is suffering from obesity. Person is suffering from obesity. Obesity means what? You are having body mass index more than 30. You are having body mass index more than 30. That means you are whatever आप जो कार्बोहाइड्रेट्स खाते हैं जितना चाहिए उससे ज़्यादा खाते हो, उतना कार्बोहाइड्रेट का देते हैं, they are converted also eating a by obesity. So hypolipidemic drugs, they are used in a same condition, like they are used in the atherosclerosis, they are used to prevent the strokes, they are also used in the obesity to decrease the lipid level. Now atherosclerosis, what is atherosclerosis? What is arteriosclerosis? Atherosclerosis or arteriosclerosis. What do you mean by atherosclerosis? No. Atherosclerosis means what? Deposition of lipids in the inner layer of your blood vessel. You can see over here in this diagram, this is your heart, and these blood vessels are known as a coronary blood vessel. Vessels supply blood to the heart. The blood vessel heart को blood supply करते हैं, इनको अपन क्या बोलते हैं? Coronary artery. Coronary. Now this is the normal coronary artery. ये जो first है artery. If there is a increased lipid or if there is a लिपोप्रोटीनीमिया, मतलब ज्यादा लिपिड अगर ब्लड में है, ज्यादा कोलेस्ट्रॉल अगर ब्लड में है, there is a deposition of this lipid, this deposition of this cholesterol in the inner layer of your small arterioles like a coronary artery and cerebral blood vessels. That causes the ischemia, stroke and heart attack. That can also leads to formation of clot. Clot भी बन सकता है ना, clot भी बन सकता है, यहाँ पे ischemia हो सकता है, atherosclerosis or arteriosclerosis. So high or increased blood level of your LDL. There was a question also on this. Question भी आ चुका है एक बार, नहीं बहुत बार क्वेश्चन आ चुका है. तो you can see increased level of LDL is having highest risk of atherosclerosis. Increased serum level of LDL has a highest risk of atherosclerosis. So VLDL increase भी atherosclerosis हो जाएगा, LDL obviously. But whereas increased HDL मतलब high density. अगर HDL बढ़ गया तो that has a protective function. If LDL is increased in the plasma, that can lead to atherosclerosis. As a highest risk for atherosclerosis has been proved. It has been observed. It has been proved that person having highest level of LDL, LVD, and LDL and VLDL, they are having highest risk of atherosclerosis. but HDL is a protective in the nature. Low density and low density lipoproteins, they can cause atherosclerosis, but HDL is anti-atherosclerosis. Now, extreme increase in the triglycerides. अगर बहुत ज़्यादा ट्राइग्लिसराइड बढ़ गए आपकी बॉडी, that is related with either pancreatitis, and also your body will get a cholesterol. Body में cholesterol आता कहाँ से? You will get a cholesterol from either diet or body will synthesize it. Body will get cholesterol from either diet. खाना खा रहे हो कैसे कोलेस्ट्रॉल आएगा? जो आप बटर वगैरह ले रहे हो, एनिमल फैट है. If you are not ingesting cholesterol, then obviously body will synthesize the cholesterol, because cholesterol has its own function in the body. Cholesterol का काम body में है. We have already seen cholesterol का the function. So that's why if you are not giving cholesterol to your body will synthesize it. Your body will synthesize the cholesterol in the liver. And now, what is arteriosclerosis or atherosclerosis? Formation of a plaque, or formation of a plaque. You can see plaque or congestion. Formation of plaque or congestion, which is made from a cholesterol ester, smooth muscle, platelet, plug, collagen and calcification. मतलब अगर आपके ब्लड वेसल जो है कोरोनरी आर्टरी या जो सेरेब्रल आर्टरीज है उसके इनर लेयर इंटीमा में अगर डिपोजिशन होता है फैट का, है ना, फैट का डिपोजिशन होगा पहले, उसके बाद में वहाँ पे थोड़ा स्मूथ मसल का भी मास आएगा, प्लेटलेट अट्रैक्ट होंगे, प्लेटलेट एग्रीगेट होंगे, वहाँ पे जो कोलेजन फाइब्रस प्रोटीन होता है कि आर्टरीज में वो आएगा, वहाँ पे कैल्सिफिकेशन होगा. ये सब होने के बाद में जो फाइनली डिपोजिशन होता है, सी दिस इज द येलोइश डिपोजिशन डायग्राम, दैट इज नोन एज प्लेक or that is known as plaque in the intima of medium size and large size blood vessel. This causes narrowing of arteries, lumen, and it can leads to ischemia. जो पार्ट को ब्लड जाना है वहाँ पे ब्लड नहीं जाएगा और वो क्या होगा, वहाँ पे इश्चेमिया हो जाएगा. That can also result in the ulceration of walls of artery, thrombosis and distal embolism. होगा इससे, because of this there is a weakening of arterial wall, है ना, जो arterial का जो arteries का जो wall है वो weak हो जाएगा, and that can lead to aneurysm. What are the common sites for development of atherosclerosis? Common site कौन सा है? Most common is a coronary artery, and that's why increased lipid level causes the blockages in the heart. Then cerebral blood vessel, that can cause to stroke, that can lead to stroke, leading to ischemic heart diseases and myocardial infarction, stroke. What are the major risk factors for the atherosclerosis? आपका जो हार्ट में ब्लॉकेज होता है उसके लिए मेजर फैक्टर्स कौन से? What are the major factors? Obviously age and most common age, sex, blood pressure, diabetes and smoking. Blood pressure, diabetes, smoking, hyperlipoproteinemia. These are the risk factors for atherosclerosis. Means if you are having blood pressure issue, blood pressure problem, that can lead to atherosclerosis. If you are having diabetes, that can lead to atherosclerosis. If you are addicted to smoking, if your lipid level is high, that can lead to atherosclerosis. Atherosclerosis or atherosclerosis. Now you can see over here different lipoproteins. यहाँ पे देखो अलग अलग टाइप के lipoproteins कौन से lipoproteins, we have already seen that. But here I have composition, means lipoprotein, its size and composition. So how much percentage of triglyceride, cholesterol, phospholipids and protein. First one is a chylomicron. पहला लिपोप्रोटीन है chylomicron. Size is around 500 to 1000 nanometer. तो इसमें 98% क्या होता है triglyceride. 98% is a triglyceride in the chylomicron. Cholesterol phospholipid is nil. It is also very in a small quantity. Now you can see very low density lipoprotein VLDL. So 43%, the 43 nanometer is the size. No triglyceride, cholesterol and phospholipids are also there. Things are also there. But have a look at a LDL, low density lipoprotein. So only 22 nanometer in the size, 15% triglyceride, but 60% cholesterol. 25% phospholipid and 20%. 60% is a cholesterol. Now high density lipoprotein HDL. So in that HDL 8 micromillimeter nanometer is the size. There is some part of triglyceride in that. You cholesterol 30% cholesterol is there, but 60% phospholipids are very good. That's why it is known as a good cholesterol. HDL is good cholesterol, LDL is bad cholesterol. Why? Because HDL has a 60% phospholipids, so protective in nature, and LDL has a 60% cholesterol. LDL में कोलेस्ट्रॉल ज़्यादा है, that's why bad cholesterol. LDL में कोलेस्ट्रॉल ज़्यादा है, that's why it is known as bad cholesterol. HDL में कोलेस्ट्रॉल है, but phospholipids ज़्यादा है, good cholesterol. You can see we have also seen lipoproteinemias in the last lecture. Type 1 lipoproteinemia में ना chylomicron increase होता है, but type 1 type 1 lipoproteinemia में chylomicron type of proteins increase होता है, but it does not type 1 hyperlipid. Type 2A type 2A lipoproteinemia में LDL is increased and there's a risk for sclerosis. Need a treatment of statin or drugs. Type 2B, type 2A and type 2B in both is the cholesterol. So cholesterol type 2 and type 2B lipoproteinemia. Type 2A type 2B lipoproteinemia इसमें है ना जो लिपोप्रोटीन्स होते हैं LDL VLDL ये बढ़ता है और इसमें कोलेस्ट्रॉल भी बढ़ता है. टाइप 3 लिपोप्रोटीनिया में आइडियल एंड intermediate density chylomicron they are increased. Fibrates. Type 4 can be treated with the fibrates and nicotinic acid. Type 4 treatment does not require. Type for the type 5. So only type 2A, type 2B, type 3, type 4. These are the types of lipoproteinemia where you need a treatment. ट्रीटमेंट कौन से लिपोप्रोटीनेमिया के लिए कौन से टाइप के लिए लगता है? टाइप 2 3 फर्स्ट टाइप 1 एंड टाइप 5 लिपोप्रोटीनेमिया doesn't need any treatment. Now ट्रांसपोर्ट ऑफ लिपिड, आपके बॉडी में लिपिड्स का ट्रांसपोर्ट कैसे होता है? मूवमेंट ऑफ लिपिड इन द बॉडी, ट्रांसपोर्ट ऑफ लिपिड इन द body. See, triglycerides and cholesterol. You will get this from diet. Triglycerides, cholesterol from the diet. They are transported by chylomicrons. Chylomicron type का lipoprotein है. Chylomicron lipoprotein will transport triglycerides and cholesterol from the diet VLDL, very low density lipoprotein that will transport endogenous triglyceride from liver to the, आपके बॉडी में जो ट्राइग्लिसराइड से ट्रांसफर करता है VLDL to the blood, from liver to the blood. Now in the blood vessel, triglycerides chylomicron, ब्लड वेसल्स में क्या है कि काइलोमाइक्रोन में जो ट्राइग्लिसराइड्स दे आर मेटाबोलाइज्ड, triglycerides of chylomicron they are metabolized by lipoprotein lipase, you know, and whatever fatty acids are formed, they are utilized by tissue, fat and muscles. जो काइलोमाइक्रोन का मेटाबॉलिज्म होगा उससे जो ट्राइग्लिसराइड्स रिलीज होंगे, है ना, वो मेटाबोलाइज होंगे बाय द लिपोप्रोटीन लाइपेज, फैटी एसिड जो भी मिलेगा वहां से, दैट कैन बी यूज्ड फॉर द टिश्यूज लाइक मसल्स एंड फैट. नो रिमेनिंग ट्राइग्लिसराइड्स, बचा कुचा ट्राइग्लिसराइड दैट इज मेटाबोलाइज्ड बाय हेपेटिक लाइपेज, लिवर का लाइपेज, एंड काइलोमाइक्रोन रेमनंट. Chylomicron remnant means having cholesterol, only cholesterol, that is taken up and used by the liver for the synthesis of steroids and क्या होता है कि जो काइलोमाइक्रॉन्स लिपोप्रोटीन, उसमें जो आपका ट्राइग्लिसराइड कोलेस्ट्रॉल होता है वो पहले ब्लड वेसल में ब्रेकडाउन होता है. कौन करता है ब्रेकडाउन? lipoprotein lipase. Whatever fatty acid will be released from that triglyceride, that can be used by muscles to get energy, or that can be stored in the fatty tissue. Remaining triglycerides from the chylomicron, they are metabolized by hepatic lipase. Liver में जाएगा, liver भी metabolize होगा, and chylomicron's remnant means having cholesterol, that is taken up by liver again and converted into steroids and bile acids. As a result of this cholesterol to liver में क्या है? फैटी एसिड, फैट एंड मसल. ये जो ट्रांसपोर्ट है, कारण क्या होता है, जो भी कोलेस्ट्रॉल है लिवर को जाता है, तो फैटी एसिड है तो फैटी एसिड के टिश्यूज को जाता है. Now when triglycerides production of body increases, जब बाहर से तो जो ट्राइग्लिसराइड आ रहा है मेटाबोलाइज हो रहा है ना, लीवर को जा रहा है, बट व्हेन ट्राइग्लिसराइड प्रोडक्शन इंक्रीजेस इन द लीवर, जब लीवर में ट्राइग्लिसराइड का प्रोडक्शन होता है, VLDL, very low density, also synthesized and released. Now triglycerides are mobilized by lipoprotein lipase, LDL is converted into IDL. ट्राइग्लिसराइड तो लिपोप्रोटीन लाइपेज मेटाबोलाइज करेगा, बट जो VLDL बना है that converted into IDL. IDL मतलब इंटरमीडिएट डेंसिटी लिपोप्रोटीन, में ट्राइग्लिसराइड एंड कोलेस्ट्रॉल इक्वल होता है. नाउ दिस IDL is either converted into LDL. ये जो आइडियल इंटरमीडिएट डेंसिटी लिपोप्रोटीन है वो कन्वर्ट किया जाता है LDL में बाय द हेपेटिक लाइपेज. ओनली, है ना, LDL में ओनली कोलेस्ट्रॉल होता है, और इट इज टेकन अप बाय द लिवर बाय LDL रिसेप्टर. तो जो LDL क्या करता है, ट्रांसपोर्ट कोलेस्ट्रॉल टू वेरियस टिश्यू, और इट इज टेकन अप बाय द लिवर. LDL क्या करता है, कोलेस्ट्रॉल बाकी टिश्यूज में लेके डिपॉजिट कर देता है, फिर मेटाबोलाइज भी हो जाता है. बिकॉज ऑफ कैरीज द कोलेस्ट्रॉल टू द अदर टिश्यू कैन कॉज द आर्थराइटिस. और HDL जो है हाई डेंसिटी is synthesized taking cholesterol helps to transport the cholesterol from tissues to the liver. HDL कैसे बनता है? HDL जो लिपिड बनता है by using the tissue cholesterol, carries cholesterol to the liver, reverse transfer. That's why it is a good cholesterol. HDL is a bad cholesterol. HDL good क्यों है? HDL bad क्यों है? Because LDL carries cholesterol and HDL carries cholesterol from tissue to the liver. That's how lipids are transported. Transport. Now management of this lipoproteinemia. ज़्यादा लिपिड लेवल हो गए तो मैनेजमेंट के हाउ यू कैन मैनेज management of hyper, obviously reduction in the stress. आप stress का करो, reduction in the stress, reduction in the weight by doing exercise, modification of diet. You can modify the diet, consume less fat, stopping the alcohol, and if lipoproteinemia is because of the another disease, that the disease like the diabetes or hypertension or hypothyroidism, use of lipid lowering drugs decrease the intake of saturated and trans fat. जो लिपिड लेवल अगर बढ़ गया आपका तो यू हैव टू कंट्रोल और यू हैव टू डिक्रीज द इंटेक ऑफ सैचुरेटेड फैट एंड ट्रांस फैट. सैचुरेटेड फैट क्या होता है? जिसमें डबल बॉन्ड होता है उसको अनसैचुरेटेड बोलते हैं, एंड डबल बॉन्ड जिसमें नहीं उसमें सैचुरेटेड होता है. तो मोस्ट ऑफ द ऑयल हैज अ डबल बॉन्ड्स जो आप ऑयल खाते हो. बट इफ दैट ऑयल इज रिपीटेडली हीटेड, दैट इज डन बाय योर staple food, whatever staple food you are eating, owner of that doing same thing is heating the oil. वो बहुत बार आप जो समोसा खाते हो, जो staple food खाते हो, उसमें एक ही बार ऑयल डालता है, वो दिन भर वही चलता है. इसमें का जो डबल बॉन्ड्स है दे आर, मतलब उनका जो अनसैचुरेशन था, जो अच्छा था, वो नाउ सैचुरेटेड फैट्स, ट्रांस फैट इज आल्सो डेंजर. इंक्रीज द कंजम्पशन ऑफ meat, low fat which you can eat. You can also eat, you can use the 3 fat. So pentonic acid and also is omega 3 fatty. Omega 3 fatty acids are omega 3 fatty acids. These are the measures, or these are the management points that you can manage the hyperlipoproteinemia. Stress, you can reduce the stress, weight, you can modify the diet, stop your bad habits like treat the underlying disease if hyperthyroidism is there. You can use lipid lowering drugs, the intake of saturated and trans fat, increase the consumption of poultry products, low fat, milk from which lipid has been removed, helping, you can use vegetables, icosapentaenoic acid and docosahexaene, or drugs which are used to manage the lipoproteinemia, drug which decreases the lipid level. They are classified by in a two ways. First way, the classification based upon the outcome. वो exactly क्या करते हैं? So first was the drug that decreases the cholesterol level. In that drug which decreases the cholesterol, in that first is statin, angiotensin inhibitor. Then cholestyramine, ये क्या करते हैं? कोलेस्ट्रॉल को एब्सॉर्ब नहीं होने देते. फाइबर्स, इजेटिंग ezetimibe, amine resin is the all decreases the cholesterol. Now, second class drug which decreases triglycerides. Example आता है fibrates. Third class है drug which decreases the both triglycerides and cholesterol. यहाँ आता है nicotinic acid or vitamin B3. And fourth class is the antioxidant. Again, you can see the classification based upon the mechanism of action. पहला है HMG-CoA reductase inhibitor. HMG-CoA means hydroxymethyl butyryl-CoA, है ना? That is a key intermediate in the cholesterol biosynthesis. Rate limiting step is HMG-CoA reductase. That is, है ना? That is inhibited by statins. Atorvastatin हो गया, pitavastatin, lovastatin, simvastatin, parvastatin, rosuvastatin. All these statins inhibit the de novo synthesis of cholesterol by inhibiting this HMG-CoA reductase enzyme, which is a rate limiting enzyme. Second, bile acid sequester. So bile acid combine होके complex बनाएंगे and they prevent the abscess. Example is a cholesterol. Third class is a lipoprotein lipase activator. Lipoprotein lipase जो है lipase activator lipoprotein को break down करने वाला enzyme activator. That we have gemfibrozil, bezafibrate, fenofibrate, profibrate. Lipolysis inhibitor फिर का breakdown inhibit करने वाले. Other drugs ezetimibe, classification और classification देख लो. Hypolipidemics तो लिपिड लेवल को कम करने वाले. Hypolipidemics based upon the mechanism. Again, first drug which inhibit the HMG-CoA. HMG-CoA reductase inhibitor. HMG-CoA मतलब ये hydroxymethyl butyryl CoA inhibitors. They are called as. इसमें सब में क्या रहेगा? स्टैटिन टर्म कॉमन रहेगा. लोवास्टैटिन, सिमोवास्टैटिन, parvastatin, avastatin, rosuvastatin, pitavastatin. All these are known as statins. They decreases the synthesis of cholesterol in the. Second class is a bile acid ester and the absorption of. क्योंकि लिपिड्स क्या है, बाइल एसिड के साथ में है ना, वो इमल्सिफाई होते हैं और बाइल एसिड सिक्वेस्ट्रेंट. cholesterol resin and cholesterol are the drugs. Then lipoprotein lipase so known as a PPR alpha मतलब peroxisome proliferated act. They are known as a fibrate. So called as fibric acid. Like profibrate, means fenofibrate. Profibrate is no more used. Fenofibrate is gemfibrozil is also. Now third class क्या रहेगा मेजर? The lipolysis triglyceride inhibitor, nicotinic, and fourth class is a steroid inhibitor. They will prevent the abscess and steroid. Ezetimibe or ezetimibe. It can be silenced. Ezetimibe. Now we'll see the drug individually देखेंगे ड्रग कौन से individual drugs. पहले statins, cholesterol and ezetimibe. They are known as the first line drug. They are the first line drug used in the. Remember statins, cholesterol and ezetimibe. Then the fibrates, fibric acid derivative, fibrates, niacin, they are known as the second line drugs. स्टैटिन का मैकेनिज्म क्या है? मैकेनिज्म ऑफ स्टैटिन, so they inhibit the de novo synthesis of cholesterol in the liver. तो लीवर में कोलेस्ट्रॉल बनता है बॉडी का, तो और that HMG co-irritatase. So they prevent the de novo synthesis of cholesterol in the liver by binding to a hydroxymethyl CoA, that is HMG co-irritatase. They binds with the HMG co-irritatase statins and inhibit the HMG co, which is a rate limiting step in the synthesis of cholesterol. Okay, via malonic acid. Cholesterol बनता है via HMG co-irritatase. We have already seen that is inhibited by statin. We have already seen this pathway in the biochemistry. The rate limiting enzyme, that is HMG co-irritatase inhibitor, that is inhibited by statins. As liver requires a cholesterol, the biosynthesis of fatty acid, biosynthesis of steroids and bile acid, they inhibit here, but still after inhibiting the de novo synthesis, liver requires a cholesterol for synthesis of steroids and bile acid. What will liver do? It increases the uptake of LDL. क्या करता है? LDL का, LDL को बोलता है जो सेल्स, जो टिश्यूज है, ब्लड है, उसमें LDL are present on the liver surface. Cholesterol is not there, liver will call LDL, come here, I will break down you and I will utilize your cholesterol. Statins are the most powerful drug which lowers the LDL, low density lipid level कम करने में सबसे कारगर ड्रग होते हैं. Also decreases the triglycerides and LDL. They have no effect on the lipoprotein. HMG co-irritatase inhibitor एक्टिविटी कब होता है? मैक्सिमम द एक्टिविटी है ना, HMG co-irritatase inhibition activity is maximum at the night, and that's why statins are given at the night. दो तीन बार क्वेश्चन हो चुका है. Statins are given at the night. Why? Because the HMG co-irritatase inhibition is a maximum in the night. Then pleiotropic effect of statin, other effect of statin, in addition to decreasing the cholesterol. So additionally, they are also antioxidant, anti-inflammatory, anti-proliferative. Statin HMG co-irritatase को इनहिबिट करते हैं, कोलेस्ट्रॉल कम कर दे. But in addition to that, they are also antioxidant, anti-inflammatory, proliferative properties. But these effects are also known as pravastatin followed by rosuvastatin. They are the most potent. Potent मतलब क्या? अगर डोज कम लग रहा है तो ज़्यादा पोटेंट. rosuvastatin, pitavastatin, they are the potent. Lovastatin and lovastatin, they are the least potent. ज़्यादा पोटेंट pitavastatin. कम पोटेंट कौन है? Lovastatin. Pravastatin and rosuvastatin. Pravastatin most commonly used, वो longer acting है ना. Pravastatin is a having active effect on ring. Atorvastatin and simvastatin, they are mostly used drug. ये longer acting होता है. इनका half life जो है around 40 days. 90% oral absorption is there except lovastatin, completely absorbed. कभी कभी क्वेश्चन आता है drug is a completely, lovastatin is a completely absorbed. Now lovastatin, simvastatin are the prodrugs. Lovastatin, rosuvastatin, they are a fluorinated analog of all these drugs are having high first pass effect. They undergo first pass. देखो मैकेनिज्म क्या है? critical enzyme for the cholesterol synthesis, there is a HMG co-irritatase. Critical enzyme for the cholesterol synthesis, and various statins like atorvastatin, rosuvastatin, simvastatin, parvastatin. They inhibit the HMG CoA release. Because of the inhibition, क्या होगा? There is a reduction of endogenously synthesized cholesterol. तो cholesterol बनेगा नहीं body में. Because of that, liver will use endogenous cholesterol synthesis. More important. Cholesterol बनेगा नहीं तो क्या होगा? Cholesterol तो लगता है body के लिए, ना? So they will call upon LDL. That increases the LDL receptor in the liver, and because of the increased LDL receptor, vigorous uptake of LDL from plasma. लो डेंसिटी प्रोटीन होता है ब्लड में, तो बोला जाता है उसको कम किया जाता है. Fall of LDL in the plasma and removal of LDL cholesterol. So statins will lower the LDL cholesterol. Adverse drug reaction क्या है इनके? Adverse drug reactions of these statins. Major adverse drug reaction is a myopathy and hepatitis. Statin को liver toxicity है, muscle toxicity. Increases the hepatic amino transferase level. Hepatic liver में जो enzymes होते हैं उनके लेवल बढ़ा देते हैं. Rhabdomyolysis rarely can cause impotence. Impotence can cause gynecomastia, memory loss, means amnesia, insomnia. Insomnia मतलब if you are not able to sleep. Mood changes, depression. All they are contraindicated. They are not used in the children and patient with the liver disease. Use क्या है इनका? Use the use of statins. They are the first line drug for type 2, type 2A, type 2B hyperlipoproteinemia as well as secondary hyperlipoproteinemia. They are also used in the prophylaxis. Prophylaxis मतलब क्या? Prevention of. They are used in the prophylaxis of myocardial infarction, ischemic heart disease, diabetes mellitus and familial hypercholesteremia. अब जहाँ पे कोलेस्ट्रॉल लेवल बढ़ जाता है उसमें. Google lipids. Google lipids they are moderately active. They will decrease the LDL moderately and slightly increases beneficial effect in hyperlipoproteinemia. Google lipids are developed by Central Drug ARI लखनऊ. जो Google फॉर्मोल होता है उसका स्टेरल फ्रैक्शन होता है, अवेलेबल एज अ 25 mg tablet. Google lip certain fibers, soluble fibers like mucilage from psyllium, ये सबको लास्ट होता है. mucilage, gum in the oat products and beans, they also decrease cholesterol to a lesser extent. ये भी कोलेस्ट्रॉल कम करते हैं. दैट्स व्हाई फाइबर ज़्यादा खाना चाहिए. Propofol is an antioxidant inhibit the oxidation of LDL, develop LDL and HDL both. जो ezetimibe होता है, ezetimibe is a prodrug है. It is a prodrug to acetyldione, derivative of 2-acetyldione, that is a ezetimibe. Yeah, it is converted into active metabolite known as a glucuronide derivative. It binds intestinal mucosal transporter and inhibit the absorption of cholesterol, dietary as well as from bile. Absorption नहीं होने देता है ezetimibe. This results in the more uptake of LDL by the urinary circulation. ये क्या करता है कि जो इंटेस्टिनल म्यूकोजल ट्रांसपोर्टर होता है एब्सॉर्ब कोलेस्ट्रॉल की, उसको इनहिबिट करता है. mine is a product to metabolite is like glucuronide. The derivative of 2 acetate 1 in a ring system होता है. What are the adverse effects of this ezetimibe? Adverse reaction का सर थोड़ा हल्का हल्का आएगा. डिस्कम्फर्ट, डायरिया, अथरालजिया. अथरालजिया मतलब बोन पेन. ये बच्चों में केस क्या है? as a statistically with the statin. Next है cholesterol. The bile acid cholesterol होता है. They are given in the form of sachet. Dose भी ज़्यादा होता है इसका, equal to 4 gram per day. Sachet is available. Sachet is mixed with the water, kept for time to the stability. ना बड़ा sachet अंदर निकल नहीं सकती, पानी में भिगो के रखना पड़ता है. Mechanism of action of cholesterol. Chloride salt of ion exchange. What is that? Cholesterol is a ion exchange resin. Chloride salt of ion, basic ion exchange resin, binds to the bile acid, forms insoluble acids which are excreted in the feces. Basically ये क्या करते हैं? They prevent the absorption of exogenous cholesterol and increases the metabolism of endogenous cholesterol. In response to that, liver mobilizes the LDL by 2 gram per day. Waiting, heartburn, constipation. Interfere with the absorption of fat soluble vitamins and other. उसके डेरिवेटिव भी है जैसे कोलेस्टिपॉल. Similar drug like a common available as a sachet and colesevalum that is available in the tablet hormones. They are the similar drug to the क्या करते हैं? cholesterol bile sequestration. How they act? Cholesterol will bind with the bile because bile में क्या है? Bile acids and they are responsible for the absorption of lipids and lipid soluble vitamins as well as cholesterol. Once colesevalum binds with the bile acid, forms a insoluble complex, decreases enterohepatic and increase conversion of salt to the bile acid in hepatitis. Decreases the intercellular cholesterol concentration, increase take of LDL. That's why that for remaining points we'll see the tomorrow the same time. We'll try to finish this chapter.